access to the healthcare system with quality and equity is what every country in the world desires. The ideas and actions towards the collaboration among children, youths, adults, and relevant agencies in Thailand are the lessons for the world citizens from various communities, societies, or countries to learn from and share with one another, which will lead to the people's equitable physical and mental health status in their own context. Health Statute. Governance by network in community level. Nong Subdistrict, Phanom Sarakham, Chachoengsao. Over the past 40 years, Thailand has developed its Thai health system according to the direction of the World Health Organization, continually using various concepts and models, particularly the development of healthy public policy in a participatory manner that is regarded as one of the paths of the health system in Thailand. Dr. Ampon Jindawatana, Secretary General, National Health Commission Office of Thailand, said, "One major element in the participatory healthy public policy development is the empowerment of the community to be stronger in working on health, using the Health Statute, or Statute on Health System of each community as a major tool." The tool helps various sectors in each local community to jointly formulate public policies, called Statute or Rules on Community Health System, by the community and for the community. The mechanism used in developing the Health System Statute is joining forces as 3 clusters of networks of 1. State and political sectors, 2. Academic and professional sectors, and 3. Popular or civic society, all at the national level down to the community level. Here at Nong Subdistrict, in Phanom Sarakham District, Chachoengsao Province, there is a picture that reflects the participatory movement of healthy public policy at the community level, based on the Statute on Nong Subdistrict Health System. Today, a monthly community meeting is being held for representatives from several sectors, including state officials and civil society members, as well as state health personnel. Here, what is different from other places is that all sectors have jointly set up the major working principles of the organization, in line with the Community Health Statute. That is, all the people in Nong Subdistrict are healthy, based on the agricultural occupation practice. Patnida Mingsamon, Director, Ban Tonna Subdistrict Health Promoting Hospital, said, "At the beginning, we worked on health promotion, and we learned that most people in the community are farmers. Some of them used chemicals that definitely affected the human health. We realized that tackling the problem only by the health sector would not be feasible, as it would be untimely. After learning about the health statute from other places, we were interested in this matter and discussed it with the Chief Administrator of the Subdistrict Administrative Organization. Wan Chai Mi Wandi, Chief Administrator, Nong Subdistrict Administrative Organization, said, "It is my duty and personal interest to work on the community issue and farming practice. We decided to learn more about such matters and held a discussion with community leaders. All of us agreed that we had to proceed even though initially we did not fully understand what it was. Through a series of community forums or meetings and working in collaboration with health officials, we told all concerned that the health statute is just an agreement, not a law." The Statute on Subdistrict Health System is an agreement adopted by sub-district residents on what they want to see, to be, and to have. The desirable conditions that lead to physically, mentally, spiritually, and socially healthy status, based on the self-management within the locality. All the draft resolutions, based on the community needs, had to be endorsed by the community meeting, and then classified for use as the framework in designating the direction and goals of the health system development in the future. The working groups have been set up and assigned to work on various issues specified in the Statute on Nong Yao Subdistrict Health System No. 1, 2012. The agricultural plot being shown here belongs to Mr. Virat Prongchit, one of the Nong Yao community members who has adopted the chemical-free agricultural practice. Mr. Virat agrees with the Statute on Nong Yao Health System and said that he likes farming and agrees with the food safety practice. So he has joined the food safety group and, after gaining the knowledge about such practice from health officials, he has applied the knowledge in his agricultural plot, which is now a learning center in line with the sufficiency economy philosophy of the community. Many local residents and other people from other districts have come to learn and share their experiences in such practice at the center. The practice principles are in line with many chapters of the Nong Yao Health Statute. Virat Prongchit, Chairperson, Young Smart Farmers, YSF Group, said, "Our action on food safety and organic agriculture is in accordance with one of the provisions of the Subdistrict Statute on Health System. The Health Statute is the agreement drawn up and endorsed at the meeting of residents in the entire Subdistrict, based on our joint efforts in identifying the problems and finding ways to resolve them. As a group, we grow organic vegetables for the residents of Nong Yao and other neighboring villages, so all of us can get safe vegetables for consumption, to be healthy, and to reduce health problems." Regarding the roles of the health sector, in Nong Yao Subdistrict, there are 2 sub-district health-promoting hospitals that collaboratively provide health services to the people, in collaboration with Phanom Sarakham Hospital. They all organize a multidisciplinary health team to make home visits and provide home health care, including rehabilitation for bedridden patients. Their experiences have shown that one of the causes of ill health is the consumption of unsafe food. In this effort, additional forces are obtained from village health volunteers who have been working together with state health officials for a long time. According to the Nong Yao Subdistrict Statute on Health System, consumer protection is one of the elements of their work. Today, some village health volunteers are conducting tests for toxic chemical residues in the food at the shops selling fresh products and prepared food. That is the food safety surveillance action under the Consumer Protection Program in the Subdistrict. Today again, the health volunteers are inspecting the vegetable plot of Mr. Virat. In a well-coordinated effort, they all are sharing the knowledge and ensure that the agricultural products meet the food safety standards. Even though the health volunteers have been trained by staff at the Subdistrict Health Promoting Hospital, additional or refresher training for them is provided as needed. That is the reflection of the work on health personnel development as prescribed in one of the chapters of the Subdistrict Health Statute. Sompram Bunnun, Chairperson, Village Health Volunteers Group of Ban Ton Na Village, said, participating in the actions prescribed in the Nong Yao Health Statute, village health volunteers who are very close to the community serve as coordinators between villagers and health officials. We help create good understanding among villagers in realizing that this is the joint effort of all residents in Nong Yao, and its goal is all residents' healthy condition. In connection with the prevention and control of diseases and health threats in the sub-district, such efforts are not neglected, but they are a major task for the community. Now, some health volunteers are conducting a survey of households to check and eliminate the breeding places of Aedes mosquito larvae, the vector of dengue hemorrhagic fever. The outbreak of the disease is an important health problem in Thailand as a tropical country. Chachoengsao, Village Health Volunteer, Nong Yao Subdistrict, said, "We work with volunteer spirit, providing healthcare and disease prevention services to the community. We are a small part of this effort, and the result is safe and healthy people in our community." In preparing the Subdistrict Health Statute, community participation is the key element in creating and sustaining the effort, as it is just an agreement without any punishment clause. A series of regular meetings is also important so that the problems will be resolved with the joint consideration and action of all concerned. Today, the meeting is considered the budget for sub-district development, which is under the responsibility of the Subdistrict Administrative Organization, in line with the Subdistrict Health Statute. Sunan Bunprasert, Chief Executive, Nong Yao Subdistrict Administrative Organization, said, "The residents of Nong Yao Subdistrict take part in problem solving and benefit from the community meeting. We would like the community to identify the problems and find ways to resolve them, and we have got the budget for such actions." In implementing the statute on sub-district health system, the management of resources with adequate budgetary support of each local agency, based on the key issues of community health, is important. Today, a meeting is being held to review the budget from the Subdistrict Health Promotion Fund, which is partly allocated by the National Health Security Office and managed by the Subdistrict Administrative Organization. Several health projects that will be implemented with local integration in the future are also being reviewed by the committee, comprising representatives from various sectors. Dr. Witnai Sawaddiwan, Secretary General, National Health Security Office, said, "I believe that the statute on sub-district health system has been drawn up through the participatory process and consensus involving all sectors in the community. In implementing the statute to achieve the established goals, the National Health Security Office will provide financial support. After the community has implemented something on a pilot scale and is confident in its effectiveness, the action will be sustainable." Dr. Ampon said, "The health statute is the community's rules on health, drawn up by the community, for the community. No one else will do it for the community, but the community members will have to jointly do it for themselves. The National Health Commission only provides the conceptual guidance and invites all concerned to share the lessons learned and then formulate a public policy if they think that such ideas are useful. After that, they will implement the policy. No need to wait for any action by the government or the Ministry of Public Health. All is done at the community, for the community, and belongs to the community."